Cervical screening is indeed very important because we have a very robust evidence to suggest that it is an efficient way to reduce the risk of cervical cancer. So it is one of the branches of prophylactic medicine that actually we as doctors make sure that there is no precancerous disease, which can be treated easily, which is the way to prevent cervical cancer. So cervical screening, it is two things. First, what type of cells hanging on the cervix? Are these cells normal or abnormal? And if they are abnormal, what level of abnormality they are? And each level of abnormality can be related to a level of disease in the cervix. One of them or two of them can be precancerous. Now, the other type of the cervical screening is the HPV. So what we do is HPV testing. Now, we moved in the NHS to do HPV testing alone. However, in the private sector, we still do both the HPV testing and the type of the abnormality of the cell. The evidence so far suggests if the HPV testing is negative, then there is no need to do the type of the test or the type of the cell. However, we still pick up from time to time subabnormal cells which are not related to HPV, like cells coming from the lining of the womb, which sometimes they can hang into the cervix, and sometimes we can as well pursue further investigation to check this abnormality. It is a very easy test to do. It is an examination, an intimate examination in the clinic, where we make sure all the privacy setup is made and the chaperone is present. We explain to the patient that it is like a speculum examination of the vagina, and then we visualize the cervix, and very gently we take some cells using a special brush hanging on the cervix. So the patient, most of them, they feel a little bit of discomfort or nothing at all, or some of them report some scratching on the cervix. So very, very unlikely there will be a little bit of spotting after the procedure because of taking the cells. So we diagnose cervical cancer. We diagnose as well precancerous disease, or we diagnose HPV-related problems with the cervix, as well as I mentioned before, we can diagnose some abnormality from the lining of the womb, especially with young ladies or sometimes with menopausal patients. So there is a schedule which we respect, and this schedule will depend on the patient age. So normally we do not do cervical screening before the age of 25. However, in very certain circumstances, we accept to do one or two smears before the age of 25. After the age of 25 until the age of 50, normally it's done every 3 years. And then after that, the frequency will reduce to become less than 3 years, up to 5 years. After age of 65, we stop doing cervical screening because the risk of cervical cancer goes quite low. If the patient stick to the schedule and the timetable, the chances of having cervical cancer extremely low.